If you're someone with acid reflux and you know it, meaning you've got the classic heartburn-like symptoms, you feel that burning in your chest, then you have what's called classic acid reflux. But it has a twin brother, if you will, called silent reflux, and up to 50% of people who suffer from reflux suffer from the silent type. And they're very, very different. In fact, if you're put on PPI medication to treat silent reflux, it can even worsen the condition, which I'll go into why that is. So jumping into it, because it's very important that you know if you have silent reflux, because long term it can create some serious issues for you. And of course we want to get to the root cause of it so that it doesn't continue bothering you. So let's look at the symptoms associated with it. You can have a chronic cough, you're clearing your throat a lot, you can feel hoarse or even lose your voice. You can have breathing type issues, feeling almost like an asthma. You can have a sore throat or a lump in your throat where you just feel like something's stuck there. You can have coughing fits, especially nighttime coughing. And you can also have tooth erosion, which is something your dentist will notice at your back teeth particularly, where they'll say there's acid erosion in your teeth. So those are the symptoms, and as you can see, they're quite different than our classic acid reflux. So because the symptoms involve what I just said, the silent reflux is very often misdiagnosed as postnasal drip, or you have asthma, or you have some kind of infection in your sinuses, on and on. You have allergies. So various meds are used, and you're kind of going down these roads, and it's not working because that's not the root cause. That's not what's causing these symptoms. So untreated, if it's left untreated, silent reflux can cause permanent damage to the vocal cords, which of course is scary, and also airway inflammation, and even increase your risk of cancer of your voice box or your throat. So not something to ignore, and you really want to know if you have it, so that's why I'm doing this video. So the mechanism is interesting because in your esophagus, so that's the tube that connects your mouth to your stomach, you have what's called an upper sphincter and a lower sphincter. And the sphincters are just valves that basically sense food or drink is coming, and then they open and allow that to pass, and then they close back up again. And also the esophagus has a motility action to it that just kind of keeps things moving in the right direction. So again, you have an upper esophageal sphincter and a lower esophageal sphincter. The lower one is just above where the esophagus and the stomach meet. And the lower one is sort of the classic one we talk about with hiatal hernia syndrome, where the pressure of the stomach has basically not allowed that sphincter to work as well because of the constant pressure, and that's allowing acid to reflux up. The upper esophageal sphincter is different. It's made of different type of muscle. So it actually gets affected by stress and anxiety, shallow breathing, which is also a part of hiatal hernia syndrome because the diaphragm is not working as well as it should, because the stomach has compressed and pushed up on the diaphragm. Now the diaphragm can't function as well as it should, so you get shallow breathing. Also, sleep apnea and snoring can also affect the upper esophageal sphincter. So again, different things affecting it other than the shallow breathing, which both have in common the upper and the lower. Now, the other mechanisms associated with the upper esophageal sphincter not working as well is that you can have vagus nerve tone abnormality. Now the vagus nerve is your longest cranial nerve, comes out of your brain, it goes down the front of your neck, goes to your chest, your heart, your esophagus, your stomach, your abdomen, and all of your digestive organs. So it goes not everywhere, but it goes to many, many places in the human body, and it very much affects sphincters, so these valves that open and close. So if the tone of the vagus is abnormal, you're not going to get that nice tone of the sphincter, and it's not opening and closing as it should. So vagus nerve tone, getting to the root cause of anything aggravating that, is very important. Now there is this kind of bi-directional effect where you can have poor vagus nerve tone and have symptoms associated with hiatal hernia, like acid reflux and the sphincter's not working well. And then you can have the sphincter's not working well and altered digestive function, right? And then that's going to affect the vagus. So the vagus affects the gut affects the vagus. So, you know, sometimes you're sort of playing one against the other, which is why you have to deal with both and optimize both to really get balance restored. Because if only you do only one, then that one's getting affected by the other and vice versa. So you have to be comprehensive in your treatment, which is why we do it the way we do it. So hiatal hernia, as I mentioned, will also affect the upper esophageal sphincter. Diet and lifestyle, always. Poor diet, poor lifestyle will, and I talk a lot about what a good diet is and lifestyle issues, so I won't go into that right now, but of course that affects. And then a really interesting portion of this is that the silent reflux is not really due to acid. So when we think of reflux, we tend to think of acid coming up from the stomach, but other things can come up from the stomach. Pepsin is an enzyme that your stomach makes, and in the presence of acid, pepsin gets activated. It's called pepsinogen when it's in its inactive form, and in the presence of acid in the stomach, it turns into pepsin, and it basically breaks down, it digests proteins. So we do protein digestion in our stomach. Pepsin is what does it. Now when you have these weakened sphincters, the pepsin can actually reflux. Also bile from your gallbladder can reflux, and I'll get into why it's less acid and more of these two. But so the pepsin refluxes up, and what happens is that the upper part of the esophagus into the voice box and the throat are they're not designed to have these enzymes coat them. The tissues are very sensitive. So the pepsin can kind of bind onto these tissues and then just kind of lay there dormant until what? Until you consume something with acid, a soda, coffee, citrus, tomato, and that acid is enough to then activate the pepsin, and now you're getting these symptoms that we've been discussing. So a very interesting mechanism that's different than the classic reflux. This is why PPI medication is problematic, because all the PPI does is it decreases the acid in the stomach. It doesn't stop reflux. All it's doing is decreasing the acid quantity such that the acid, when it does reflux, is less irritating to that lower part of the esophagus. So the reflux is still happening, it's just less irritating, which doesn't affect this mechanism of the bile and the pepsin at all. So you still get the symptoms. What else did I want to talk to you about? I think that was mostly it. The biggest thing though is, how do we get to the root cause? So we have this upper esophageal problem. What we noted is that the pepsin is coming up. We have a lower and upper esophageal sphincter that is not working as it should. That's kind of the crux of the matter. So then why is it not working the way it should? That's where we're getting into the vagus, which is a nervous system issue. Not hard to retone or balance the tone of the vagus nerve. There are some exercises you can do, but again, it has to be in concert with normalizing digestive function, or as I said, one's going to just push against the other and you're not going to get anywhere. So when it comes to a hiatal hernia, what we know that to be is that the stomach is being compressed from inflammation that's creating increased intra-abdominal pressure, and that stomach's being pushed up, the diaphragm's being pushed up, and because of that elevation, that lower esophageal sphincter is being compromised, then the upper esophageal sphincter is being compromised. You also, with hiatal hernia, you get into the shallow breathing, which affects the upper esophageal sphincter. I know this is a long list, but it's less complex than it appears, because when you're normalizing gut function and you're normalizing vagal tone, that's kind of like the two key issues we're coming down to here, is what is the diet and lifestyle, and why is the microbiome inflamed, and what is the source of the increased intra-abdominal pressure. That's all gut related. Then we have vagus nerve. Okay, vagus nerve tone is not the way it should be. Why? And you're working those two sort of against the middle to normalize this. But the problem here is that you can have these symptoms that don't seem like acid reflux at all. And I hear from a lot of you saying, it's weird, I was diagnosed with a hiatal hernia. I don't have any acid reflux symptoms. Reflux doesn't bother me at all. But this form of reflux can be bothering you, and you have these other symptoms. Like, I mean, I have a friend, she's clearing her throat all the time, and you know, there's just these things that happen, and it's not, you're so accustomed to it, you know, you the person, you know, as the owner of the body, and maybe somebody in your family, you're just like, that's what she does, she kind of clears her throat. Or somebody who has sort of a chronic cough, or you know, these various symptoms that they're kind of used to, and they've been down the road and they saw their doctor, and the doctor said, well, doesn't seem to be this, that, or the other, I don't know, and they're missing this aspect of it with the silent reflux. Or you know that certain acidic foods bother you due to that activation of the pepsin, as I was mentioning, so you just stay away from them and you think all is fine. But it's not, because that reflux of that enzyme is coming up. Maybe bile is coming up from the gallbladder as well, and it's creating a lot of irritation, and we need to get to the root of that so that it doesn't turn into something long-term where you can't reverse out of it anymore. So I hope this was informative and it explains some things. Maybe you have friends, family, or yourself that have these symptoms. And I know I've heard so much from patients over the year. It's like, it's driving me crazy. I feel like something's stuck in my throat, you know, and I've had people, you know, had an ENT look, you know, in my upper throat, and they're like, there's nothing there, you're fine. And sometimes they don't see the irritation necessarily, but you have that feeling, right? You have that feeling of something stuck, or you have the cough, you have the nighttime coughing. And also think about the fact that the upper esophageal sphincter can get the malfunction can occur from stress and anxiety. It's like, okay, so getting into lifestyle issues, and where is that coming from? So that's what I love about what we do, our comprehensive approach, where we're looking at hormones, and we're looking at diet and lifestyle, and we're measuring gut function, and we're looking at vagus nerve function, and it really comes down to really a few key issues, but very important that you know whether you have this or not, and we get treatment underway. And treatment is natural, it's not drugs, it's not surgery, and you can catch it early before some long-term damage is done to the vocal cords or your throat, etc. So I hope this was helpful again, and you definitely share this video if you know someone who suffers with these symptoms. If you enjoy the content on my channel, I would encourage you to subscribe. We're trying to increase our subscribers. We have a lot of viewers, but most people are not subscribed, and what subscribing does is it just allows more people to see the video and get educated so they can help themselves, and that's the whole reason I'm here. So I very much appreciate you, and thank you for watching, and I'll talk soon.